uncontrolled rapid increase in cell growth is cancer.
So how do you move patients from fear to hope?
Stage 4 cancer does not mean it's over. This era is of personalized medicine. We need to tailor the treatment to the patient. Tobacco is one of the most common cancer causing agent in India. So social media is probably a time just to have some entertainment for 5 to 10 minutes, not to choose the medical information or the treatments from the social media.
So welcome to the program, Doctor, and it's a pleasure to always have you.
Thank you.
So as an oncologist, on a fun note, when you are at a party, do people suddenly become very health conscious, or they just avoid you because you have to remind them of the screening test?
Yes, I think definitely it's not so cordial as we see with other specialities. So you should be an example setter for them.
Yeah.
You should not smoke as an oncologist, and you should be very conscious about doing things which people will be observing, because that's the healthy habits which we'll be looking to inculcate in the general public. And they'll be more afraid for the word cancer. So even if you say that you're a cancer doctor, it's terrifying. Still that stigma is there for both the cancer and the cancer doctor. Funnier note, I think people say that we should never come to an oncologist.
Yes. Somewhere inside their heart, they have that fear and stigma still, as you've mentioned. So how do you move patients from fear to hope?
Whenever we are encountering a patient who has a diagnosis of cancer, most of the times, at least with our practice, we see is primary counseling is not done to the patient. That's in a way lucky, in a way I'll say it's a bliss for the patient, because he does not know what is happening around. So whenever we see a patient with curable cancer, we try to take them through the journey of how earlier patients fared and see what else can be done to see that the treatment at least is completed and they are cured. And when we have a patient with stage 4 cancer, so that's where I think probably most of the patients are in a dilemma whether to go ahead with the treatment or not. So stage 4 cancers does not mean death, and stage 4 cancer does not mean it's over. And convincing patients is a tough thing. It takes some time, definitely, and effort both on the part of the doctor and the team to drive home the point that there is a scenario where it has to be treated in a proper way. And with the abundance of knowledge available both through ChatGPT or the Google, patients occasionally do come with wrong information than what is right for the patient.
Yes, I think you've truly said that internet today is loaded with information, and the right information is more important coming from the right sources. So we all say that cancer is cancer. Is it true anymore? I mean, because we hear about personalized medicine, we hear about precision medicine. I mean, what exactly are these terms?
So what we need to understand is there is some genetic signature or some mutation which is causing this disease. So a normal genetic machinery is different. Someone who has a disease, it's different. So we need to identify that specific mutation, which probably can be targeted with specific medicines which we have now. Probably if it is hit at the right spot, we see that this is going into remission. So that's the personalized medicine. So earlier probably we used to say all breast cancers go for surgery, chemotherapy and then radiation. That's it. Now we are not doing that way. So now each patient, according to their age, pre-existing medical conditions, their stage, the type of breast cancer, and now probably we are moving into even the genes they have and see what best treatment can be done for them. This era is of personalized medicine. We need to tailor the treatment to the patient, not like giving one medicine for all the patients and say that this fits everyone. So that's the brightest thing, that personalized medicine has changed the way we treat the diseases.
So you mean to say that two patients can have the same type of cancers, but the treatment can completely vary?
Yes. I think lung cancer, it's entirely individual treatment. We usually are doing for all patients now. I think we have moved to compulsory genetic testing. Without that, we are not doing treatment for lung cancer. And we might see 10 patients of lung cancer, 10 patients are treated in a different way. And other good thing in lung cancer is immunotherapy. So immunotherapy also changed the way lung cancers are treated. So we do have good number of patients who are treated with this immunotherapy, single agent immunotherapy, what we say, those who have this high PD-L1 or the immunotherapy signature, which is very high. We don't even give chemotherapy to these patients. So these patients do exceptionally well without any need for chemotherapy.
So apart from the latest treatments, what we usually talk about, now let's be honest, how about the lifestyle habits that be it nutrition or sleep or exercise? What's the importance of these things in a patient's journey to recovery?
Even in a normal person, I think all the specialists do say that a healthy lifestyle is recommended. But what is a healthy lifestyle? That's a big question. No one knows what's the healthy lifestyle. So there are variable definitions. We don't have a hard fast rule that this is healthy lifestyle. But in general, I think going with the natural way of diet, whichever way the nature has given, in the most natural way is the healthy lifestyle. So now how is it? So avoiding the refined carbohydrates, high sugars, all the pizzas and burgers which you get it outside, and cool drinks or whatever the fast foods which you are eating. So these are all the negative things. And I think next is about the ideal body weight and having a healthy exercise. So these two are linked because obesity, we know that it's a risk factor for most of the chronic diseases and also cancers like colon, breast, endometrium. It is proven beyond doubt that for someone who is obese, these cancers do happen. So intense physical activity for at least 20 minutes a day is what most of the specialists do agree. So these are the few things. And avoiding carcinogens. What are these carcinogens? They are the cancer causing agents. So we know tobacco is one of the most common cancer causing agent in India. So just avoiding tobacco will reduce the number of cancers by 40 to 50% in India. And we do have other environmental factors probably which we cannot change, but we need to see that we are as close to nature as possible.
But isn't cancer, very mysterious kind of a disease? Because, you would feel all normal and one day you just get diagnosed with some advanced stage of cancer. I mean, does that happen often to people?
Most of the cancers are aggressive and they grow very rapidly. That's the definition of cancer. Uncontrolled, rapid increase in cell growth is cancer. So patient might have symptoms when that growth reaches a critical level to cause symptoms. Based on the site of the body, we see this disease. A healthy person can also have cancer because not everything is in our control. We can change few of the risk factors which we just discussed, modifiable risk factors as we say. Few we cannot change. We cannot change the way our genes are, the mutations we acquire, or at times we cannot change the atmosphere around you. So whenever there is a symptom, we need to see whether it's a simple symptom which probably disappears in a couple of days. If it is persisting beyond 2 weeks, it's better to get it examined by your doctor to see what exactly.
So as an oncologist doctor, what are some non-negotiable habits that you have inculcated over the past few years in your lifestyle?
There are a few things which probably are very important for everyone. So it starts with sleep. So I make sure to sleep at least 6 to 7 hours a day. So ideally, I think people say 8 hours, but that's a luxury. So a good sleep of 6 to 7 hours is something which I try to inculcate. And second is at least some exercise in the morning, which I do usually for at least 30 to 50 minutes every day, 5 days a week at least. I do have cheat days, Saturdays and Sundays. I usually try to have holiday for the gym and workouts. And regarding the diet, I usually prefer vegetarian diet, and I try to avoid most of the red meats, fried foods, and at times we have to be social, so we do go to restaurants, but I try to avoid most of the foods which are deep fried and try to see which are as cooked as near your home cooked food. And I know I never smoked till now. Being a total teetotaler is a difficult thing, so I occasionally have some wine or something.
So as we've discussed earlier, that social media is full of miracle cures. So how do you think that people can differentiate between hope and hype?
Yeah, I think it's all the way it is looked at. So I think most of the social media apps have your behavior or your scrolling linked feeds which do come. I think it's not an ideal site for choosing the information about cancer or treatment. So that's what I would like to put a message. So social media is probably a time just to have some entertainment for 5 to 10 minutes, not to choose the medical information or the treatments from the social media. We have a lot of authentic cancer related sites, cancer.gov. We have the National Cancer Grid from India. These do have information about most of the cancers which a patient needs to know, what are the treatments available and how the treatment fares. So other than this, I think rest all unpublished, unverified sources need to be viewed with caution, and probably they are more like causing anxiety and pushing the patient in the wrong direction, and at times even changing the way the disease is treated.
So do patients come to you? I'm sure they do come after watching some Instagram reels or something on the Facebook and that made you smile. Was there an incident like that?
Yeah, smiling, I think I'm doing more often nowadays with the things which I'm seeing from the feeds. So I think a lot of things happen to a cancer patient. So the first thing which probably is happening most often with all the patients is about the sugar. So someone has put a rule that cancer cells survive on sugar, and we need to stop sugar altogether in the diet. No added sugar in the diet, and that will kill the cancer and cure the disease. So I was surprised initially, but now almost this information has to be repeated to all patients that cancer cells survive on glucose, which is even synthesized if we don't eat sugar. It is taken from the carbohydrates we eat also. So even if we avoid sugar, there is no reason why a cancer cell will not survive. So that's the most funniest thing, which probably is very viral now. I think probably most of our cancer patients are still not convinced that avoiding sugar is not the right thing to stop the progress of the cancer.
So on the personal note, do you have a sweet tooth?
Yes, I do like sweets. I have sweets at times, so not on a daily basis. So yeah, I think chocolate is something which is very good. So that satisfies most of us sweet tooth. It's healthy, and probably it also reduces your craving for sugar.
So if you had the power to eliminate one cancer myth from the internet, what would that be, doctor?
Cancer is treatable. Most of the times patients do feel that cancer is not treatable and not curable. So this is a common myth. So patients are the living examples for this cancer. I've seen patients even with stage 4 cancer surviving beyond decade and saying that when are you going to stop my treatment? So that's the situation where we are in today. Cancer is becoming like a chronic disease in advanced stage. In early stages, yes, we do have cases which are curable.
So before we wrap this episode, doctor, is there any message that you would like our viewers to remember from this conversation we've had?
Cancer, the incidence is increasing. There is no need to be afraid of having a diagnosis of cancer or living with cancer. The myth was there earlier that cancer is death. That is gone. The fact is, cancer is no more another dreadful disease. It can be treated, it can be cured. A lot of treatment options available. Have hope. There is a good number of treatment medications available, and with so much expertise available, I think right near your home, I think it's not going to be that bad as it was earlier. And in the future, we are going to see many more newer medicines coming into the field, and the treatment is also going to be more personalized with the precision oncology, what we are practicing. I think most of the doctors are now towards precision oncology, and that's where we are, and we are going to probably see a lot number of cancer survivors in the future, and we'll be having these patients spreading the hope about the disease.
So thank you, doctor. It was wonderful having a conversation with you. Thank you so much.
Thank you.